By the time I considered donor egg, I would say I felt very broken. I felt very disillusioned. I felt like I had failed through all the different options. It was hard to believe my doctor that this was actually a treatment that could work for me.
I basically had a 2% chance of getting pregnant naturally. I had a 2% chance of getting pregnant through IUI or even IVF. Because everything else was perfectly fine except for my eggs were old.
I have done 12 transfers. 12 transfers, and I have one child. Like, that's insanity. Like, you realize how emotionally draining each of those processes are, just, wondering if it's gonna happen and just questioning every little thing that you did. Is that why I didn't get pregnant?
I knew a couple people growing up who had infertility issues, and a close friend of the family even, and seeing her struggles and the miscarriages and the stress that she went through was difficult.
I had a friend in Bethesda, and she had tried IVF many years ago, and it was unsuccessful. And then her friend had tried it recently with Shady Grove, and she was like, you should go for it. Like, I bet so many people would want your eggs.
All over the world, young women work with fertility centers to help infertile couples have children. 18,000 donor egg cycles are performed in the United States each year. Medically, the donors experience the same risks as infertility patients going through in vitro fertilization and are compensated for their time, effort, and assumed risk. Egg donation is an extremely important treatment option for recipient couples. It is often the last hope for the prospective mother to have a pregnancy and the prospective father to have a genetic link to their child. Shady Grove Fertility is the largest fertility clinic in the United States. Performing 800 donor cycles each year, it is also the largest donor egg program in the country. Before women are admitted into the program, they must go through an extensive pre-screening process. Recipients then go through a database to select their donor. Once a donor is selected, they go through a cycle in which their ovaries are stimulated to produce the eggs, and then go through a minor surgery for the egg retrieval. After the eggs are retrieved, they are fertilized in the lab and prepared for an embryo transfer. 2 weeks later, the recipient will find out whether she is pregnant. We will take you inside the egg donation program at Shady Grove to explore the experiences of donors and recipients. While we will focus on Shady Grove's program, the standards and practices reflect the vast majority of fertility centers all over the United States.
One of my older cousins had trouble with infertility, so she went through the process and got pregnant with a donor egg. So before that I had never even heard of the process or knew it existed. So when I heard about that, I got interested in it and started looking it up a bit online, and that kind of sparked the interest.
During pre-screening, fertility centers must educate potential donors about everything involved with an egg donation cycle in an effort to obtain legal informed consent. Informed consent is a clear appreciation and understanding of the facts, implications, and future consequences of an action. Any healthy woman between the ages of 21 and 32 may initially be considered for egg donation. However, before a donor is admitted into the program, they must pass a rigorous screening process. Candidates go through an extensive psychological assessment, and medically, they are tested for their potential fertility and genetically transmitted diseases. The pre-screening process is very extensive, and only a select few ever become donors.
We get about 7,000 applicants a year, and we only accept about 3% of the applicants. So 97% of the women that apply are not going to qualify.
So you do kind of like a pre-screening application online, and it's really short, just a couple questions, and then if you pass that, they let you do their full application, which is pretty intensive. It took probably 2 or 3 hours to do. Goes through complete family history, so I was on the phone with my mom, asking about cousins and aunts and uncles who, if they had any medical problems. So that that took a long time. Once that went through, within about a week, they called me back and told me that I passed that. Then I came in for some blood work, and then I did donor day, which is a couple hours.
These are all the things that I'm going to go over today.
Okay.
At the end of the day, I want you to feel that I've answered all your questions and I've explained all the risk and everything to you. We've been doing Donor Day for about 4 years now. It's very extensive information regarding what we expect of them, regarding risks, how to do all the medications that donors do throughout their donor cycle. We also include the general overview of the testing that they undergo. The fact that the eggs, once they're retrieved, do not belong to them any longer. They're not responsible for the egg's future. They're not, nor do they have anything to do with the outcomes.
We want to make sure that we've taken the opportunity to look at everything current and long term. We want to make sure that the donor is making as best of an informed consent as she can.
I mean, they have lots of information on their website that you can look through, but I don't think you fully get the whole picture until you come here and have someone walk you through it step by step, hold your hand through it, and tell you what to expect and what's going to happen.
I met with the counselor several times before even being put on the list to donate. So I knew absolutely. She brought up questions I hadn't even thought of. So I really had to think about it before actually 100% being able to and agreeing to.
The whole psychological evaluation is really a huge piece of informed consent because, again, we want to make sure that she really understands the implications of her decision, that she has thought it through. Sometimes medical questions come up as we talk about the process, something that we don't feel that is appropriate for us to answer. So we make sure then that the medical team comes back and addresses those issues or concerns.
During the pre-screening process, there are considerable benefits to the donor. They may learn that many of the processes that they're going through are normal. On the other hand, while excluding them for being donors, they may find out medical issues that are important for them to know. For instance, they go through a full physical examination, pap smears and so on. Maybe their first interaction with adult female medicine. Sometimes they haven't been to anything but a pediatrician in the past. They go through a full ultrasound examination of the pelvis. They can find out about fibroids or cysts or endometriosis or other medical disorders of the pelvis that they may not have known about for years or decades even, and may need treatment or evaluation. Again, some of them may preclude them from being donors, but it's important that, and we counsel these women once we find these abnormalities.
We look upon the donor as a patient in this process, just as we look upon our infertility patients or recipients as patients here. We feel that she needs to be very well informed, she needs to be very well prepared, she really needs to understand the long-range psychological implications or consequences as best we know them and understand them today, that she has thought through the implications of this decision as far as children that are being created that will be genetically related to her out here, that she has all of her questions answered.
As fertility doctors taking care of both recipients and donors, we have a responsibility to both parties, and it's very important for us to provide the best medical care and insights for our donors. We wanted to see how well we were doing in this regard, so we set about doing a survey, and we surveyed over 1,000 donors who've been through us in the last 11 years. We received 235 replies, and we asked them about their experience, about how well informed they were, what side effects they had, and whether they had regrets about the process. And we were very reassured by the results. The vast majority of donors felt that we'd done a very good job informing them about the medical risks. The majority felt that we'd given them good insight into the emotional issues, and while the majority felt that we prepared them well with regard to long-term side effects, some felt that we could have provided more information. However, it's interesting to note that with regards to the important question of do they regret having pursued this treatment, less than 3% had regrets. And we find that very reassuring. The fact that 97% of our donors feel good about the decision sometime after doing the cycle, I think is a strong endorsement of the process from the donor's point of view.
Once a donor passes pre-screening, they become a part of the donor database. The donor database is made available for recipients to select donors and includes childhood photographs, as well as extensive information about the donor physically, personally, and medically.
You want to look at everyone, because even though looks is one portion, it's only one portion. So we spent a lot of time, we looked at education, we looked at, there a lot of time on their abilities. If you remember, we read all the personal statements. I think the personal statements for us was one of the key factors. It definitely was the tipping point.
You had to look through it a couple times before you're like, oh, yep, this is great, I like this. Or you had to, it took a while. I must have went on the site, oh God, I don't know how many times.
When we were ready to do it, the doctor had said to us, don't try to find the perfect donor, because you might have to go through this many times. You won't necessarily get lucky the first time. So we logged on and just looked at our curiosity 1 or 2 times, and then the 3rd or 4th time we logged on, it was pretty quick. We saw the profile of a donor that really appealed to us immediately. And we were just getting ready to go on a honeymoon, and we clicked on it and said, let's try it. Why not? I might have to do this many times. And the next day we were matched to her.
When donors have been admitted into the program, they are put on birth control. Once they are selected, the recipients order the stimulation medication on the behalf of the donor and begin taking birth control as well to time their cycle to the donors.
It was just very symbolic, that one pill I had to take that was starting the whole process. But once we started that and the injections, preparing your body for it, it was very exciting. And then getting daily updates from Shady Grove.
You come in for a couple of pre-screening appointments just to make sure your health is still in good standing. They draw some blood, and you have a monitoring appointment where they just make sure everything looks good. And you're assigned a nurse. They kind of match everybody up and give us a schedule and let us know the dates that they think that the procedure will take place on. And then you start your meds.
The stimulation typically lasts somewhere between 9 to 14 days, and during that time they're taking 2 or 3 shots a day. They'll also have about 5 to 7 ultrasounds and blood work, and somewhere in that time we'll start to be able to plan when their retrieval will happen, but typically with 2 to 4 days notice. So they really do have to be committed to the process and ready to kind of drop what else is going on in their life and have a retrieval the day the eggs are ready.
So here's your left ovary. Taking a deep breath and hold it and start measuring some milk. Very umbilicus. So you have around 8 over here on the left.
They pretty much follow up, every other day. You have appointments for blood work and monitoring about every day once once you start the medicine, and then as it gets closer you come in every day, and they keep a really close eye on everything and adjust medications a little bit here and there, and then about a little less than 2 weeks later you go in for the procedure.
The egg retrieval itself is a surgical procedure. It's minor surgery under IV sedation. They have to have a friend or a family member bring them to that procedure, and it takes about 15 minutes, and we usually expect they're going to be a little bit sore and groggy the rest of the day, so they need to go home and rest and have, typically we like them to have a responsible adult with them to just make sure they're okay.
This would be my 4th time, and it's been a really good experience so far. I mean, I haven't had any side effects of any kind. Hasn't really been painful to me, even after the surgery.
You guys are going to be back together until she goes in. When she does go in, this is where you're
This Thursday, I did the Lupron shot, which is this trigger shot, at 9:45 at night. And today's Saturday, and I have the surgery, or the egg retrieval being done at 9:45 in the morning.
I'm just going to get your numbers here, and then we'll go over all your paperwork, talk about the flow of the day. So Rod's going to come in and start your IV. He's our anesthetist. He'll ask you a couple questions, and then we'll take you in right around your trigger time, but we'll keep checking back with you to see how you're doing. Okay? Any questions?
The staff's been great. They're so friendly, and they definitely don't make you feel like you're just a nobody or that you're being used in any way. You're just as important as anyone else they treat. They've never pressured me to do it. If I've come back because I wanted to. The main reason being that I want to help couples that can't have kids
An egg retrieval is a surgical procedure. It's a minor surgical procedure, but nonetheless it is. There's no discomfort during the procedure because the donor is under anesthesia. However, afterwards, a majority of our respondents did report mild to moderate discomfort that day. We used medications to mitigate that, but nonetheless they did have some discomfort. Some had a little discomfort the following day. Fortunately, only 5% of our donors experienced severe pain, and most of that's related to ovarian hyperstimulation. With our new protocols, ovarian hyperstimulation is greatly reduced, and severe pain along with it.
Egg donors go through identical cycles to in vitro fertilization patients. While this practice is firmly established, there are some risks to the procedure that it is important for donors to be aware of.
It's most important to remember the Hippocratic Oath, which is first do no harm. And here we have a particularly important responsibility because these are young women who are not going to be obtaining any medical benefit from egg donation. So they're going to go through medical treatment, stimulation of their ovaries with fertility drugs, and an egg retrieval without personally deriving any medical benefit from these procedures. So what are the risks they face?
There's a small risk that someone might have bleeding after an egg retrieval because we are poking the ovaries with a needle, but that's a fairly low risk.
Any medication, they have risk of just having a personal reaction that the average person doesn't have.
There is a risk of ovarian torsion. That is, again, a very, very rare situation where the ovary could twist on itself after doing surgery on the ovary and could result in someone losing an ovary. But again, a rare situation that's probably important that someone be aware of because it's a serious complication, but one that probably happens in 1 in 200,000 cases. The biggest risk of egg donation is ovarian hyperstimulation syndrome. We are stimulating the ovaries, and instead of only making 1 egg, as someone's ovaries would normally do in a month, we are getting somewhere between 15 and 40 eggs from these donors. We do try to minimize the hyperstimulation with the protocols that we use, but some women still will get hyperstimulated. Their ovaries will be fairly large. They sometimes get fluid in the abdomen, get dehydrated, and need to have fluid drained.
Probably 2 days after the retrieval is when I started feeling symptoms. It started with like bloating, and I couldn't lie flat, and it was uncomfortable like to walk up and down the stairs. So I had to go back and end up having fluid drained from my abdomen.
About 1 to 3% of women who have IVF may experience ovarian hyperstimulation. Maybe 5 to 8% have some symptoms of bloating or fullness, weight gain, nausea, and we're following them by lab and by ultrasound. And as I tell our donors, we don't hide that. If we're concerned that they're at risk, or if we're concerned that they're demonstrating some tendencies toward hyperstim, we're going to let them know what to watch for.
Every time I called and had a question or concern, my nurse told me specifically exactly what I needed to do. So I guess it's a shame that it wasn't called sooner, but yeah, she did call and check on me. Just nothing seemed wrong at that point.
We've established 2 important new protocols to mitigate risk. One has been triggering of ovulation by a medication called Lupron, which has a short half-life, reduces the hyperstimulation rate of the ovary by near 80%, and it's a much more natural egg maturing medication. It's been really revolutionary in our donor population. And number 2, we have a post-donation evaluation of all donors, which is a face-to-face physician examination, assuring that we haven't missed something like an early infection that we could easily treat and keep the donor healthy and safe.
A common question that we hear from donors is, do they lose more eggs by going through a stimulated cycle? We hear that from our couples going through their own IVF cycles as well. And the good news is the answer is no. One is born with a finite number of eggs. That's absolutely true. But in fact, during a natural cycle, a woman starts to develop at the very early stages a couple of hundred, several hundred of those, some people even say 2,000 or so, eggs, and one is ovulated. All we're doing is capturing, say, 20 of those instead of those several hundred, as opposed to one of those several hundred. So you don't go through menopause earlier, you don't lose extra eggs.
It's important to recognize that there's been 34 years of experience with IVF, about 28 years of experience with egg donation, many hundreds of thousands of egg donation cycles, and many millions, about 15 million, of IVF cycles for women with their own eggs. And the risks are the same for both groups of patients. So short term, the risks are very small and can be well managed. And long term, issues have been raised about ovarian cancer and long term impact on fertility on the donors. The data is very reassuring on this issue. With 15 million cycles of IVF performed, there have been many studies showing that there's no increased risk of ovarian cancer, breast cancer, or uterine cancer. 13% of donors reported having problems conceiving. Now, 13% is very consistent with a normal infertility rate. About 13% of the population would be expected in this age group to have a fertility problem. So it's reassuring that we're not seeing an increased incidence of infertility and consistent with other data regarding this issue.
So I donated in July, and then in the end of October I ended up pregnant myself. So I haven't had any issues since then, I mean, other than the aftermath simulation that I had right away. But other than that, I don't seem to have any problems.
A good way of assessing one's comfort with an experience is, would you do it again? And in this situation, 58% of our donors said they would definitely consider doing it again, and 92% said that they would recommend a friend or family member to be an egg donor.
I always told everybody the same thing. I don't compare yourself to what happened to me. I don't think it's very likely that it would happen to you. And like I said, up until the hyperstimulation, the whole process was relatively easy and it wasn't so bad. I was never uncomfortable or in pain before that point.
Shady Grove egg donors are paid $6,000 for their first cycle and $6,500 for additional cycles. Donors are not compensated for their eggs. They are paid for their time, effort, and assumed risk. While compensation may play a factor, most donors are also strongly motivated by the opportunity to help an infertile couple.
I didn't even know that you can get paid when I did it the first time. And I was just like, oh, because to me donation means you're donating, not necessarily because you're gonna get paid. If I wasn't getting paid, it wouldn't be a big deal to me. Donation to me shouldn't be you getting paid, it should be you doing something out of your own kindness.
We have found that donors that want to be a donor for altruistic reasons, those are really the only donors that are going to make it through the process. You know, it's not an easy process. You know, it's not just a process of you come in, you donate your eggs, you get a compensation. So I think if a woman comes to us wanting to donate just for the financial advantage of it, they're not going to get through the process because there's so many steps, there's so many layers, and there's so much involvement that if your heart's not in it and you're doing it just for the compensation, you're not going to get through. There's other ways to make some money. This is not why women get into it.
We look carefully at our donors and we ask them the question of what was their financial state. Is the preconceived notion that these are women who are financially in great need, who are being coerced to do this, really valid or not? And it was interesting to note that only 15% of our donors characterize their financial situation as poor.
I'm definitely not doing it for the money. I have jobs for that. Like, I'm a teacher, so that's my job. This is definitely just a way to help people and kind of pay back for how blessed I've been in my life.
We're screening young women to be volunteers, and we are not comfortable with women who present with any interest in selling eggs. So we surveyed altruism versus financial interest, and we're very pleased to report that 73% of our respondents placed altruism, helping to build families, ahead of any financial compensation.
It made me feel really good knowing that, well, I hope that it worked for these families, but knowing that 3 families were going to end up with children of their own. So I more was doing it for them, but got my own benefits out of doing it.
I feel like if there wasn't any compensation, it's a big commitment to donate eggs. It's not the same as sperm donation, where it's a lot quicker, a lot easier. I mean, you do have to give yourself injections. It takes about a month if you're on the birth control. So it's a big commitment to make, and I feel like if they didn't offer any sort of compensation, very, very few women would be able to do it financially or be able to justify it. I mean, you do have to taking the day off work today. Now I'm going to have to take a day off or 2 days off for the retrieval.
In most programs, and certainly at Shady Grove, in our program, we have found an appropriate, balanced way to deal with this. We will not pay donors excessive compensation. And often one of the criticisms of egg donation is pointing to way out cases, such as, Ivy League donor being paid $100,000 to donate eggs. That is incredibly rare and few and far between. And we follow the guidelines of the American Society of Reproductive Medicine in the donor compensation that we set, and we refuse to do any cycle in which any donor will receive more than $10,000 of compensation, and that would be a donor recruited by an agency externally.
After the egg retrieval, the donor has completed their cycle, and the next step is the embryo transfer. After the embryo transfer, the recipient goes through a period known as the 2-week wait, and then they will find out whether or not they are pregnant.
After we get the eggs, they are brought into the laboratory, and then the eggs are fertilized with the recipient's husband's sperm. The day after the eggs are retrieved, we can tell if they fertilized. We'll see a nucleus from the egg and a nucleus from the sperm inside what's called a 2PN embryo. The following day, the embryos will start dividing and be 2 to 4 cells. The following day after that, 6 to 8 cells. And then on day 5 to 6, they're blastocysts. For each recipient couple, we tell them how their embryos are growing on a day-to-day basis and make decisions whether we put them back into the uterus on day 3 or day 5. And then embryos left over after transfer that look good and make it to blastocysts can be cryopreserved for future attempts if they don't get pregnant, or for future pregnancies if they do get pregnant.
And every day we were getting calls. The eggs the embryo have split into 2 cells, 4 cells, and then were we going to be implanted on day 3 or day 5? It turned out we were going to be implanted on day 5. We went in, I met the embryologist, Dr. Levy did the implantation. I have a picture of it, it's an amazing photo of Lila as a 5-day-old embryo, and then I watched it be dropped into my uterus, and then 2 weeks later found out I was pregnant.
I just was floored. I hadn't had numbers that high since I had my daughter, so I was like completely overwhelmed. I was like, oh my gosh, this could really be happening. I could really. And then we got the numbers for the second blood test, and that was they tripled almost, and I was like, oh, I think this is really happening, and my husband's like, I think you're pregnant, and he's like, I'm like, yeah, I think I am, even though I know I am, I'm getting the numbers that I am, but I'm still like, I think I might be, it was just incredible.
And how many weeks do they leave this point?
You are 5.5 weeks at the moment.
We have 107 beats per minute.
That's looking very good.
Every time I go in for one of those ultrasounds, I am completely praying that everything's going to work out. And when I see the heart, when I could see the flickering on the screen, and I was like, okay. I don't know. I think I might have even seen it before Dr. Levy did. I was like, I saw it, and I was, ecstatic.
Oh, it was unbelievable, first of all, to hear the words that not only are you pregnant, but this really looks like it's a viable pregnancy. The beta looks good. It was an answered prayer for us. We had waited so long. I didn't believe that it could really happen, and then to have it happen.
I know how much I want to have kids when I'm ready, so I can't imagine how painful it must be when you want kids so badly but you can't. So I figure it would just be so worth it to go through a little bit of inconvenience on my side to help somebody with something like that.
I wondered if she's wondering what's happened since, she did the egg retrieval. But I'm just grateful that she was willing to do that.
I did think about it once, and it was actually the 3rd time when I did it. Only because I saw a kid that looked a lot like me when I was a kid. It was almost like seeing myself, but it was the boy version of myself. And I just kept on looking at him and looking at him, and the thought did go through my head. And he was, I mean, he had everything, the eyebrows, the eyes, everything. But I wasn't gonna go up to the mom and say, did you know that I could possibly be? I didn't do that. I mean, the thought went through my head and I said, oh, how wonderful. I saw the mom and I saw the dad and I just saw how happy they were. And the only thought really after that was, if that's really what if I was the donor, and great, I see them just so happy. That was nice to see, or at least even nice to think about.
Yeah, I'm a lot more optimistic, and I'm actually envisioning a second child when I look at this. I don't feel like that cloud kind of hanging over. I have a pretty clear mind about this one, and like I said, I'm already at the hospital. I mean, I'm ready to bring the baby home. So.
I'd like it to go that fast.
Yeah.
I would like it to go that fast.
There's some more work for you to do before we get there.
Yeah. Egg donation for us has meant opportunities that we didn't think we had, has given us gave us hope, and produced Lila. So it's been an incredibly rewarding and positive experience for us, because it resulted in us being able to have a family of our own and a child.
We're very blessed that technology, medicine, and donor egg exists today, because without it we wouldn't be able to have a family with 3 kids now. And that is something that we will be always grateful and thankful that donor egg exists today.
I can tell you that I give thanks to God every single day for the children that He's given me. And the minute we delivered, I would say that my heart has just overflowed with absolute joy and gratefulness. And I like to tell people that you'll never hear me complain about my children, because I'm so grateful to have children.